South Korea has one of the lowest rates in COVID-19, even if it's placed in Asia. Today, we have William to explain why.
Hi, my name is William and I'm 17-year-old only son of my family of three, and I'm currently spending my high school life in Seoul, Korea.
In what way has the quarantine affected your country of residence? If possible, please explain in a social environment form.
In the February 26th, 37 days after the first COVID-19 patient in Korea appeared, the number of confirmed patients exceeded to more than 1,000. Thus, Korean government responded with 2 weeks of quarantine for all travelers and warning citizens that this can develop into a pandemic in a second, so start self-quarantines. Soon, under the government's control, people could not use public transportations and indoor public spaces without their masks on. About 1,000 of testing centers were built new, including the drive-through testing facilities. People could get free testings. Plus, employees were scheduled for working from home programs so that they can minimize the possible danger of infection. Even people working in hospitals were forced to always keep 2 meters of distance between visitors and patients when they are not fully covered with safety clothing. When new confirmed cases found, government sent texts out of the residents informing them when the case was found and giving them the authority to access its tracking data and shut down the places the patient went to. All people who possibly had contacted the patient were tested, and if needed, they had to be locked up alone for 2 weeks with constant checking.
What are the different measures that have been taken personally to avoid the virus?
In order to avoid the virus, I did the free testing every 2 weeks in Seoul and tried not to go out since mid-February.
Between you and your mother, if one of you has to go out, but certainly will get COVID-19, would you go yourself or send your mother?
If I have to choose, I would go myself rather than letting my mom go, even if I'll get COVID-19, because it is widely known that people in the age of 10 to 30 has the lowest risk of death from the virus, and I'm in there.
From your perspective, which country has managed the situation best? The response can be in the current resident country or another one.
In my perspective, Korea is one of the countries that managed well. Unlike China, Italy, or Spain, our government didn't lock any area down or stop people from going out, but successfully flattened the curve with quick response.
According to your point of view, is the management taken by the local government adequate for this crisis? Explain your answer.
I believe the management of our local government was adequate. Just 1 week after the first case was found in the country, government urged several medical companies to immediately begin developing coronavirus test kits for mass production. Also, the government has been very transparent, collecting and providing the most information possible, and by encouraging people to be responsible and report if needed, they created a system that effectively slows the spread of the virus. Before the virus spreads all of the country, building about 1,000 of easily accessible centers that provides free testing that only takes few minutes. More than 300,000 tests were conducted, which is more than 40 times that the United States for a per capita rate. These facilities, in addition, successfully protected all the health workers. In this way, it successfully managed to stabilize the infection rate in 2 weeks.
South Korea is characterized by being one of the most autonomous countries in the world. Its inhabitants were aware of the situation from the very beginning and acted to take care of themselves and those around them. The South Korean government showed full confidence in its people, but still took action by closing down places of high concentration in order to prevent further contagion. The peak of its graph is 1,062 cases, showing that this country, being one of the largely populated countries, managed the crisis